Thank you, Conrad. And if you're between the ages of 65 to 75 and have a history of abdominal aortic aneurysm or a history of smoking, you may want to talk to your provider about getting tested. Here to tell us more about this disorder is nurse Christina Paris. So thank you so much for joining us today.
Hi, glad to be here.
Yeah, so first off, I was able to kind of, piece some things together earlier because I watch a lot of Grey's Anatomy. But for, the real world science and people at home, what is the aorta and what can cause an aneurysm? Sort of breaking down the name of this.
Absolutely. So the aorta is the main branch. It's the largest artery in our body. So we have arteries, veins, and capillaries. So arteries will take that good oxygenated blood and it takes it through our body to our organs, to all of our tissue. Veins take deoxygenated blood back to our heart so that our lungs can fill it up with oxygen. And capillaries are kind of the bridge. It's sort of in between the two, what connects them. So the main artery, it's the largest artery in our body, it's the aorta. It leaves the left ventricle directly full of good oxygenated blood and takes it to our body. It goes down into our abdomen, so it can kind of go through our chest, the thoracic aorta, part of the aorta, and then the abdominal aorta. It goes about to the belly button. Now, that takes a great amount of blood because it's the largest. And so sometimes over time, if you think about blowing up a balloon and letting it go down and blowing up a balloon and letting it go down, over time that balloon gets kind of weak, it gets kind of floppy, and that can happen. And when it ruptures, it's very dangerous, but that weakening is what we call an aneurysm.
And then what are maybe some of the symptoms that people could potentially look out for with this?
So things that can cause it, I'm going to talk about really quick before the symptoms. So like hardening of your arteries. So if you have atherosclerosis, I know I'm butchering that up, that's really plaque buildup in our arteries. So that can cause weaknesses, high blood pressure, blood vessel diseases, can also cause it to be inflamed, and infections or trauma in the aorta. Now, symptoms can really, typically there's no symptoms, so that can be kind of tricky. But you might also have some pain in your belly that kind of goes to your back. You might feel a small lump or some pulsing sort of in your belly, and that kind of goes rhythmic. Any sharp, sudden pain in your chest, upper back, belly, anytime you have that, you should always call your provider. If you are kind of short of breath, again, that's not normal, so you should call your provider. There's any number of things that can cause it. And trouble breathing or swallowing can also be big causes.
One of the things with the no symptoms is it's hard with this because sometimes, you don't notice it until it's too late. So what are some of the things that could maybe help prevent this just a little bit?
Right, absolutely. So we look at risk factors. So people who have a family history of abdominal aortic aneurysms, people who smoke or have high blood pressure, and age, anyone, like over the age of 65, we look at those folks. Now, men are more likely to have it. I think it was like 59% of the time it's men. And 9,000 people died last year of abdominal aortic aneurysms. So what they do is you, if you have these symptoms or, and you're concerned, you go and you talk to your doctor. They can perform an ultrasound. So just like when you have the baby, and they do the ultrasound of the belly. Well, this one isn't as glamorous, and they they look at your belly, but there's
no cute little thing in there.
No. And so
it could be cute.
It could be.
Is that subjective?
Absolutely. But they're looking for the size, and they'll measure it. And if you do have an enlarged aorta down there in the belly, they will monitor it routinely. And once it gets to a certain size, they will either they'll stent it or go in and do a big surgery on it. But typically they can kind of go through, it's a little less invasive, and they put these little stents that just kind of add protection to the sides of the vessels to prevent it from breaking open.
Right, and then if you do have this family history, do they routinely check you, especially if there's no symptoms but you have these risk factors? Is that something that
Right.
can be done, and how often should that be done?
Absolutely. There's many things that we do preventatively based on symptoms. We can do low dose chest x-rays to check for lung cancer. We will check for abdominal aortic aneurysms. Absolutely. We do routine blood tests to check for cholesterol, things like that. So this is just another one of those routine checks if you are at high risk.
Definitely, just another important thing, go to the doctor, get your routine tests. It'll save a lot of work in the end.
It will, absolutely. Yeah, preventative medicine, you know, going back and stenting is so much easier than trying to repair a rupture or a tear.
Perfect. Well, thank you so much for coming in, kind of telling us about this, you know, letting people know what they need to look out for.
Absolutely.
And coming up, we have what's trending, including